Good afternoon, everyone. A very warm welcome to our series of sessions on understanding the silent threat, liver cancer awareness, organized by Voice of Healthcare in collaboration with Isar Pharmaceuticals. I am Dr. Muskan Ahlawat, representing Voice of Healthcare. I welcome you all to join us today, taking an active interest in liver health. So, the liver is one of the most organs that quietly work behind the scenes to keep our body functionally active. The liver is not just a detoxifying organ, it plays a pivotal role in digestion, metabolism, energy storage, and immunity. Yet, liver disease often develops silently with few obvious symptoms, which makes awareness, prevention, and early action very crucial. In today's session, we aim to educate everyone on preventing liver disease, managing existing conditions, and promoting recovery strategies. We will explore some practical lifestyle interventions, medical treatments, and the importance of follow up that all should empower to take charge of their liver health. We are privileged to have with us Dr. Suman Kalyan, Senior Consultant in Medical and Radiation Oncology at MGM Hospital, Chennai. Dr. Kalyan brings vast experience in managing liver disease, cancer, combining medical expertise with a patient centered approach. Today, he will guide us with the causes of liver disease, preventive measures, strategies for recovery, and how individuals can maintain long liver health. A very warm welcome to you, sir, on our show.
Thank you. Hi, everyone. It's a pleasure to be here to create an awareness on the silent killer. It's liver disease and liver cancer. And occasionally, this month is the Liver Cancer Awareness Month. So, we'll go ahead with some very simple facts and its discussions.
Sure, sir. So, shall we start by exploring, some key aspects of liver health and disease prevention? Sir, my first question to you would be that what are the most common causes of liver disease in India today, and why are they becoming so prevalent?
Okay. So first I'll tell you one of the misconceptions. We always
Hmm.
combine liver with alcohol. We always think that alcohol means liver disease. It is true. Most of the liver related problems are related to alcohol. But then alcohol is not the only cause of liver diseases. In fact, in India, this epidemic of non-alcoholic fatty liver disease has been increasing. It's been classified also into a metabolic problem. It affects even people who don't drink. So,
Hmm.
who are the people affected? What are the causes of this non-alcoholic liver disease? It's mainly uncontrolled diabetes, which is very common in India. Then obesity and sedentary lifestyle associated things, and then high cholesterol. Then viral infections, which include hepatitis B and C, both B and C, and then long-term drug or toxin exposure. So all these causes liver problems. So the main question here is, who are the people, since we are talking in a social forum, who are the people who are mostly at risk for this non-alcohol related liver disease? It is, as I told, people with diabetes or any metabolic syndrome like obesity or high cholesterol, and then people who have a family history of liver disease. Liver disease not just personal now, it has a propensity in the family also. So people with family history of liver disease, they are at a higher risk compared to the normal population. And thirdly, any individual above the age of 40 with obesity or sedentary jobs have a direct risk of liver disease. So the message is clear. Liver disease is not only a drinker's disease, it's a lifestyle disease now.
Thank you, sir, for highlighting that not only drinkers get liver disease, but lifestyle changes can also, lead us to some liver disease. Moving ahead, we would like to know some practical steps that individual can take in their daily lives to prevent from liver disease.
Yeah, that's a good question because there is encouraging news. The encouraging
Hmm.
news is that early liver disease is often reversible, 80% reversible. So if detected at a stage of, whenever we do an ultrasound, we get these words, namely fatty liver. So many
Hmm.
of us with the annual health checkup would have noticed these words. So this fatty liver or mild fibrosis in the liver, This can self heal. Liver is a very beautiful organ. It can self heal itself, but only thing is we have to promote it, we have to allow it space to reheal. So what are the key lifestyle interventions we do to promote this self healing? One is diet. uh, we should focus on a high fiber diet. Incidentally, we're in India, we have a natural high fiber diet which we are slowly forgetting. So people are into Mediterranean diets also. In fact, Mediterranean diets are not bringing down, they also have a high fiber diet. But generally our Indian routine diet, the root diet, is high fiber diet. Just stick to it. Reduce your sugars and mainly refined carbohydrates. Why we always tell that, don't eat a burger, don't eat a pizza, is that they also have protein. If you notice, pizza also has veggies, but then we say no. Why? Because the fiber content, it's not about protein or carbohydrate in fast food, it's always about fiber content. Fiber content in a burger, you can just Google, is zero. So that's where we lose things. So reduce defined refined carbohydrates, reduce junk foods and saturated fats. So that's the first thing, diet. And then exercise. Even 30 minutes of brisk exercise per day is enough to bring down liver disease, reactivate liver enzymes. So that is enough. Third one is weight reduction. A 7 to 10% weight reduction over a period of 3 months is enough to reverse changes in the liver, namely fatty liver or mild fibrosis. And the last but not the least is stress management. So yoga, mindfulness, and proper sleep is very important to support metabolism. So I would stress upon sleep and hydration. These two don't cost anything. We don't have to spend anything for sleep, we don't have to spend anything for hydration. So these two are given free by the nature. We have to adopt it, we have to be mindful of that. So at least 7 to 8 hours of sleep and hydration. Take bottles of water, at least 2 liters or at least 1 liter to your office space. Just be mindful of hydration. These are very very simple changes by which we can reverse liver disease, liver changes at an early stage.
Thank you so much, Dr. Suman, for highlighting lifestyle factors and diet. My next question is related to kind of diet point, that how important is nutrition, or some food supplements that can help in supporting recovery from liver disease. Nowadays,
Yeah.
we have many liver supplements also in market.
Yeah. So good question. I think I answered part of it because
Yeah.
our own Indian diet has a lot of fiber. So fiber is the main thing when we talk about liver. So and also antioxidants. So as an oncologist, the main villain for our diet is oxidants. So that's why we try to reduce refined carbohydrates. So these oxidants, the only thing that we can add, as you told, supplements. What do these supplements give is antioxidants. Are these antioxidants present naturally? Do we have to take commercially available supplements? Answer is basically no. You can take beyond a certain age, like after 60 you cannot generally hope that diet will change everything. When we already have a liver disease or changes have already started in the liver, that time you can go for supplements. Until then, or if we have only grade 1 changes, grade 1 fibrosis or grade 1 fatty liver, we can adopt a diet. So if we are into social media, you would have seen this eat the rainbow. It was trending in Instagram about 1 or 2 years back. So what do we mean by eat the rainbow is, rainbow, you see, has many colors. So instead of
Hmm.
putting each individual fibers, if you just remember as eating the rainbow, you'll remember to add colors in your food. It's
Follow
not
your diet.
yeah, it's not artificial colors, it's
Hmm.
naturally colored things. Simply put into it, you add greens, namely green leafy vegetables that we already have, and then berries. We don't have to go for imported berries. We have berries in our own diet, like gooseberry is one of the best source of vitamin C. This is the most potent antioxidant available already. So just be mindful of covers. Add beetroot. So we already have this ABC blend. You would have seen. You would have taken ABC is apple, beetroot, and carrot. These colored fruits, they have a lot of antioxidants and anthocyanins. They are very important for your liver health. So these are some of the very mild dietary changes, and I cannot stress more on hydration and sleep. Those are very basic, and you can add this. And on top of it, you can add some supplements. As I told, ages above 60, 65, you can add some commercially available supplements. What supplements to add? Most of the supplements that we have today are fortified. So the name fortified means it's already in a balanced form. You don't have to individually pick each individual component. When you see a label, if the name is fortified, then it means it already has a balance of RDA, that is required daily allowance of all of the essential things that we need for day to day. So this is what I want to tell on a basic note.
Thank you, sir, for answering that. So, sir, as we are moving ahead, we have talked about basis of liver disease, liver cancer. Can you highlight some diagnostic tests that are available worldwide for liver disease or liver cancer?
Yeah. So coming to tests, so what
Hmm.
we think is the most one thing that people tell me when they come to my clinic is people always believe that liver disease goes unnoticed. Liver is a big organ, very mystical organ in which the disease we can't find. It's not so. You have ultrasound of an abdomen. It costs roughly around 1,000 to 2,000 rupees anywhere in the hospitals. And for liver cancer also, we have one blood test named AFP, alpha fetoprotein, which costs about 200 to 50 rupees. So these are very basic tests which can give you a red flag sign that something bad is going on. And recently we have something called fibro scan or elasto scan. So these scans tell you, if you're an alcoholic or even an occasional alcoholic, it can tell you what is the grade of changes that has already happened in the liver, what is the amount of fibrosis, what is the percentage of fibrosis and fat that is already there in the liver. For example, for a middle-aged man or woman, the approximate amount of fat that should be there in the liver is 40%. So beyond 40% is abnormal. For 40 to 60% is mild change. So all these information we get through this elasto scan, or it's commonly called fibro scan. So this can again cost around 2,000 rupees, nothing more than that. So these are basic scans that you can avail during an annual health checkup. People really don't do annual checkups even now. Even my parents don't do annual health checkups, but then that habit should catch on. So in annual checkups, what you need to do is you need to ask your doctor, you need to ask your medical health company. Most of the IT companies now, they include health checkup in their package. So you have to tick box these things. One is AFP, alpha fetoprotein, is a basic blood test. Ultrasound up down mostly would be included. Just try to include fibro scan if you have a habit of alcoholism.
Thank you, Dr. Suman. I agree with you that early intervention or going through this test must prevent one from liver health disease. So, sir, as a medical oncologist, what would you, suggest that what are key management strategies of medical treatment for person who is having a liver disease or who is going through liver cancer?
So liver cancer, as you know, is of course a bad thing to have for any person. So the key thing here is the change from a liver disease to a liver cancer. So liver disease doesn't start as cancer; it starts as as you told, mild fibrosis, or we call it steatosis, that is fatty change in the liver. From there, it goes to fibrosis, and from fibrosis it goes to cirrhosis, and from cirrhosis only it goes to liver cancer. So this entire process takes about 7 to 8 years. So within these 7 to 8 years, you can intervene. So if unfortunately we lose intervening in this, we lose having a view here and just land up with liver cancer. Thankfully, even with liver cancer, we have very effective treatments now. We have very effective managements now for early liver cancer. So liver cancer management has been simplified by using very effective liver directed therapies. Initially we used to give only chemotherapy for liver cancer or surgical resection. Now we do transplants also. Initially transplants were not done for liver cancer. So those are major treatments. Coming to simple treatments, even for a patient with liver cancer, we have these laser treatments, radio frequency ablation. These are very local treatments. They don't have side effects. and it's mostly done as even as an outpatient procedure. You won't even believe. So we use ultrasound, we use radio frequency, we use laser to take away the tumor. And very recently we have something called TAR. TAR is nothing but trans arterial radio embolization, in which we use specific radioactive substances, mostly yttrium. We have some very interesting results in that. It's not something out of the book. We are doing it in India, in Tamil Nadu, in Chennai. Around 4 5 places in Chennai are doing this TAR procedure. These are very simple procedures. No need for chemotherapy, no need for radiation also. These are already in vogue. These are for early liver tumors. Once these liver cancers become big, or the stage progresses, then only the treatment becomes a bit complicated. So once patient develops jaundice, it's prudent to bring down the jaundice and then start the treatment. And in this place only chemotherapy comes. And even in chemotherapy space, now we have something called immunotherapy. Got the Nobel Prize for the year 2018, and it's very effective in liver cancer. Now we have regimens that include immunotherapy. So for even for stage 4 liver cancer, people survive for years together now, not like initial days. Let's say about 7 years back, the average survival was just 6 months to 1 year. Now the average survival has increased dynamically to above 4 years. So that's where we stand in the treatment landscape of liver cancer.
Thank you, sir, for highlighting wide treatment modalities that are available in India nowadays. Sir, my next question to you is, what should patients know about follow-up care and long-term monitoring after they have, gone through full liver disease treatment or liver transplant or liver surgery?
Yeah. So that is also very important, because this is important for the caregivers, people who
Hmm.
have liver cancer in the family or liver problem in the family. So people always think that once you treat cancer, especially the liver, then it's gone. You don't need to worry. You can be happy. Of course, you can
Yeah.
be happy, but then it's not gone forever. The risk of recurrence or progression still remains, especially in people with chronic conditions. Already they had a liver, let's say hepatitis, a liver
Mhm.
infection, or already they had cirrhosis due to alcoholism. That is not gone. Only the cancer is gone. The risk factor still remains. So they have to be under continuous follow. So even after successful treatment, even if it was a viral disease, and we treat the virus, antiviral therapy is given. Regular follow up and monitoring are very crucial. What we do in this follow up is, generally we do LFTs, that is liver function test.
Liver
These are
function.
basic blood tests. Along with that, the blood test that I told, AFP, alpha fetoprotein, these are done every 3 to 6 months. Since they're just blood tests, we do it every 3 to 6 months to avoid repeated scans. These scans, luckily liver is easily visible by an ultrasound. We don't need very like an MRI for liver imaging. So liver is very easily seen and very promptly seen on an ultrasound, a live imaging. So ultrasound costs very less. So this ultrasound is generally done every 6 to 12 months. And the most important thing in liver cancer or liver disease follow up is lifestyle adherent and metabolic control. You just have to reduce your sugars, increase your hydration, and follow some supplements that we give, and be under monitoring, and be mindful of what we eat. So these are some basic things that we do during follow ups.
Thank you, Dr. Suman, for answering that. Sir, moving onwards, let's have a myth versus fact segment where we will clarify some most common misconceptions about liver health. My first question to you would be: many people believe that liver disease is always fatal. So, is it a myth, or it is true that liver disease is always fatal and it will lead to any casualty?
Oh no, liver disease is really not fatal always. Otherwise, I won't be sitting here talking. So, liver disease is curable. The cure rates are almost 100% in stage one, and
Okay.
as in any cancer, liver cancer is also divided into stage one, two, three,
Hmm.
and four. So, early stage, we simply for simplification we divide into early stage and advanced stage. So, this early stage is 100% curable. You don't have to think twice about it. So with early intervention, with effective treatment, and with a multimodality approach, liver cure is highly possible. And second thing is, even for advanced disease, as I told, people are generally scared of treatment, especially chemotherapy.
Hmm.
I'll tell you a fact: chemotherapy is almost phased out in liver cancer. If you see the guidelines, what we use is mostly American guidelines, NCCN we call it, or the European guidelines, ESMO we call it. So all these guidelines have already taken away chemotherapy. There's no chemotherapy drug for liver cancer. We only have immunotherapy now and targeted therapy. So these targeted therapies are nothing but tablets which people can easily take at home, and immunotherapies will be taken in a hospital. But then we don't have side effects for immunotherapy. There is no hair fall in immunotherapy. There is no tiredness in immunotherapy. So things have changed drastically even for advanced stage cancer. So the thing that liver cancer is incurable. Once you have liver cancer, sit in home and die. No, it doesn't hold good in 2025. You just have to be prompt, and you have to take away your fear and consult a expert, and then take his opinion, genuine opinion, and then you can decide upon where your treatment goal lies.
Thank you, sir, for explaining that the truth behind this myth. So, moving onward, my next question is, as you were mentioning about treatment and various modalities that are available, it is related to that only. Maybe you have answered most of it. So another common misconception that we have is only surgery can improve liver health. But as you have mentioned, there are many targeted therapies, radiation therapies, chemotherapy is not the only solution. So can you highlight some more important points for treatment?
Yeah. As you told, liver cancer, one of the main modalities of treatment even today is surgery.
Yeah.
So, surgery
Hmm.
has many types. One of them is just resecting. Thankfully, the liver is divided into segments, embryologically. So, by biology, we have 8 segments of the liver. If we are lucky enough, we get, that's why we stress upon early diagnosis. At an early stage, liver cancer will be confined to one segment, so you can easily cut off that segment like cutting a cake.
Hmm.
But if it's advanced stage and it has progressed beyond those segments and involving 2, 3, 4 segments, then it may be difficult to resect. Even then, resection is possible because liver is basically divided into two lobes, right and left. We can easily remove one lobe. In worst case scenario, the liver cancer has already spread throughout the liver. Even then, we have transplant, very good transplant teams are available in most hospitals nowadays. So liver donor, anyone with the bloodline, they can donate liver if they are HLA match. So liver transplant is also there. These are surgical options. Regarding non-surgical options, as I told, we have radio frequency ablation, we have laser ablation, we have radiotherapies, and we have this TAR therapy. In fact, chemotherapy can be given inside the liver. That's called TACE, transarterial chemoembolization. So all these are very advanced therapies, but their side effects are very less. And beyond this, we have immunotherapy and targeted therapy. Target therapy, thankfully, or target therapy is nothing but it's like chemotherapy, but it acts only on those cancer cells. So these are very specific molecules. And we have to be thankful for Indian government now, since they are making these very advanced drugs. You would have seen in the news, GST has been made zero. So these drugs are available at a very lesser cost compared to our neighboring countries. I have many people coming from neighboring countries, including Maldives, Mauritius. They come to India for treatment. So it's not like treatment is costly. It is cheaper here compared to any other country outside, including the US. So treatment is available. Treatment is not just chemotherapy now. We have targeted therapy. We have immunotherapy. So these are the other options of treatment in liver cancers.
Thank you, sir, for your descriptive answer for this. So, at last, I would like to ask, can you suggest some lifestyle practices that one should follow for good liver health?
Yeah, so I'll just enumerate some of them. I think we have discussed some of them already. So
Yeah.
for liver health, basically, first thing, as we already discussed, is to reduce or stop alcohol. That's the elephant in the room. So that covers roughly around 30 to 40% of liver health. The second thing is to add something. So once you add something, the bad things go down by philosophy. So addition is adding your antioxidant, as I told, eat the rainbow, eat colored foods, add antioxidants, reduce your refined carbohydrates, reduce sugar, and add natural fiber diet. These are something that we can add. Once you add them, the bad things automatically go down. Your junk food, you don't have space in the stomach for junk food then. So these are some of the lifestyle changes. We call it primordial prevention. Before the risk factors arise, we do it to prevent the rising of risk factors. So these are some of the basic simple dietary changes I would suggest. And I can't stress upon hydration and sleep, free to use, but it's very important for liver health.
Thank you so much, Dr. Suman, for awareing our audience for these lifestyle changes. We had a great time with you. Thank you so much, sir.
Thank you, Mushkan.
Thank you.